Hello, everyone. Thank you for joining us today. Welcome to SAVEC's new series titled Pandemic Reflections. I will keep my introductory remarks short today to allow our expert speakers to take center stage. But as this is the first session, I think a brief overview is needed. So I came up with this idea back in late 2021, and I wanted to have this kind of series because as I was meeting with different SAVEC members and organizations, I realized and I noticed that there is this urgency or this emphasis to move forward, to host pop-up clinics and to push forward, a specific type of vaccine engagement, which includes vaccine distribution. And of course, that's very important and needed. But I believe, it's equally important to have and to make time and space to reflect on the work we've done, right? To see how the work we do affects our communities, how our community members and how locals are impacted by our vaccine engagement. This webinar is the exact opportunity to do so. It also allows us to ground our work and be mindful of the work we do for 2022. Today's session is focused on women as caregivers and how repeated lockdowns have affected that role. This fits into a much longer discussion on South Asian family structures. Unfortunately, we won't have time within the hour to go over everything and address everything. That being said, questions are encouraged and we will answer them throughout the webinar or even as email follow-ups. Please keep your mics off. Please respect the speakers and respect the space. I would now like to invite Nimra Khan, Project Associate for VE, to deliver the land acknowledgement. Thank you.
The work of SAVEC and the Council of Agencies Serving South Asians takes place on traditional indigenous territories of the Huron-Wendat, Haudenosaunee, and most recently the territories of the Mississaugas of the New Credit. This territory is part of the Dish with One Spoon Treaty, an agreement between the Anishinaabe, Haudenosaunee, and allied nations to peaceably share and care for the resources around the Great Lakes. This territory is also covered by the Upper Canada Treaties. Today, Takaranto, the traditional Mohawk name of this area called Toronto, which means trees in the water, and its surrounding areas are still home to Indigenous people, and we are grateful to have the opportunity to meet, work, and play on this territory as settlers. We wish to express gratitude to Mother Earth and for the resources we are using and honor all of the First Nations, Métis, and Inuit people who have been living on the land since time immemorial. Let's take a minute to kind of settle this in. Thank you.
Thank you, Nimra. Those who attended our last session will recognize our first speaker today. Sultana Janghir has been a social service worker and social justice advocate for 25 years in Bangladesh, United States, and Canada. After immigrating to Canada, she lived in Toronto's East Danforth area, which has a high concentration of low-income immigrant families, mostly Bangladeshi immigrants. Sultana led immigrant women from the area to create their own organization, the South Asian Women's Rights Organization, or SAWRO. Sultana has extensive experience working with local, national, and international organizations to support women's rights and health. Notably, as a leader of the Gender Equality Network Canada, Sultana brings significant experience working for women's equality in her community across a wide range of fields. Welcome, Sultana. Your community insight is much appreciated.
For today's session, Sultana is also accompanied by Kishwar Laila from SAWRO.
Yes, Kishwar has been closely working with affected communities throughout this pandemic. She's the community leader at SAVEC. Currently working on a project titled Working and Hurting in Little Bangladesh, Kishwar, along with researchers at McMaster University, are investigating the procedures used by racialized immigrant workers when they injure themselves in precarious workplaces. This is a relevant discussion during the pandemic with regards to job security and safety. With a background in journalism and child and communication development, community development rather, Kishawar is an expert community animator and is highly skilled in relating to and working with people. Above all, Kishawar is a policy reform advocate dedicated to addressing intersectional gender equity faced by precariously employed racialized immigrant women. Her goal is to provide services and support to marginalized newcomer women in Toronto and across Canada. Welcome to you both.
Thank you, Warda, for giving us a, should I start it? Okay, thank you, Warda, for giving us a floor to talking here, and thanks, Casa, and thanks all of you, those who are joining in here. I see a lot of our communities ambassadors and also the communities members in here. One of our ambassadors, Hafsa, are also in here. So yeah, we are talking about that, how, pandemic impact on the women. So we see from very beginning that March 2020, when the pandemic hit the ground, we see that the job loss of the women is too high, and also not the job loss of women too high also. Like we see that the pandemic is a kind of wave. Every wave come, school close or anything happen, impacted to the women. Women are taking the caring job, and they are in the frontline worker in manufacturing, in retail sector, and they are getting impacted a lot. But we, every time from the very beginning, we requested the government a very inclusive and universal health and economic measurement to come out from this pandemic. But we see that governments are using very narrowness and shallowness measurement, health and economic measurement, and that create a very half patchwork work with a lots of gap. And because of this gap, the intersecting inequality come, and a proportion of the group of people, especially the racialized group that is also belong in Bangladeshi immigrant women, are fall behind because of the pre-existing inequality that they have in before the pandemic, and also the current condition. They push them so behind out of margin that the recovery for these women are not easy. But when we see the government policy, program, and practice that try to help the recovery times, it shows the exclusion of this group. It's not inclusive. It's not helping the racialized immigrant women to recover faster. We need a rapid recovery for them. I see in the pandemic period, we do a lot of analyzations of the research paper, and also from our lived experience, we see that the women, mother with the children of 12, under 12, are lost a job very severely. Almost 620,000 mothers lost the job in the pandemic period at February 2020, in the eve of the pandemic. And out of these things, we see that very few can return back. Currently, right now, the women unemployment rate is 17.2%. And that unemployment rate giving us kind of sense that women are not recovering well. They have lots of barriers they're facing. The main barrier is childcare. We see that childcare is a huge issue for everyone. And because of every time's lockdown, the school get closed, the employer are not giving a flexibility to the women. So then they can maintain their, household responsibility and childcare responsibility and work responsibility. And the compromising part is that women has to compromise their career. And most of the times we see the compromising part that sometimes full-time job get part-time and sometimes no job. But the whole system, Canadian system, do not recognize this vulnerability, because the way all this benefit, generated, every place it says that voluntarily leave from the job, $5,000 income previous, and some of the criteria that women fall through from this thing. We did investigation in our community at December 2020, and we find it that 30% of our communities, working women, are fall through this crack and are not eligible to apply for this benefit and pushed to a deep poverty. And that kind of inequality we also see in our vaccine engagement process. One of our ambassadors in here, Hafsa, we did a presentation last Sunday In that presentation, we mentioned it, that what kind of inclusiveness process we needed to see the, our community's vaccine engagement will going to be increases. Because right now, our community's vaccine engagement in telemedicine and also Oak Ridge Center, Oak Ridge area are lower than the average rate. And at the same time, we see the infection rate is both places too high. It looks like both of these numbers going different direction. It shows us that something is wrong. And we find it out the wrong is in here that because this community has more children than the other community. And we also see that the children infection in the whole Ontario is almost 35 or 36%. And that children's are, when they infected, it's not only the children infected, the mother get impacted. Because when the children stay home for this isolation, for this lockdown, or for this infection, the mother has to stay home. I just want to give one story from our community. One of our women we helped her to get a job in the childcare sector in November. So she is a single mother with the children, development delay. So she, December end and January, when all the childcare center get closed, and it is kind of our whole region is under lockdown. She contacted us and said what kind of benefit she is available, and we tried to apply for her in the childcare caregiver benefit that she totally entitled, totally eligible, but she cannot access this thing because she doesn't have any $5,000 prior income. And the same time, when we try to apply for her EI, for the caregiver benefit, we find it out she is not eligible because she doesn't have 420 hours that she requires. This is not the story for only one woman. This is the story for lots of women, those who left behind several times during the pandemic period, several lockdown time, without any benefit, without any income. And that creates the severe poverty. We see the gender-based violence increasing in the community because all the children, all the family members staying together, the tension between the spousal tension and the children tension, all things is coming, dumping on the women. So this condition is creating some sort of, conflict, and the violence is increasing. And on the top of these things, we see because of this economical insecurity for the women, disempowerment for the women, that is another vulnerability for the women. And we also want to see that how the government can recognize this intersectional inequality that women of the proportion, certain group of women face it, like racialized immigrant, and all this racialized immigrant, one of their proportion is Bangladeshi immigrant. Like that, inequality, inclusiveness has to be analyzed right now. And we raise all this lead coach experience, and with the recommendation that should have to be recognized. And centralization of these women issues should have to be the middle of the systemic reform place. So then all the system should have to be reformed and rebuilt the way it could recognize the vulnerability of the women. Am I crossing the 10 minutes? Okay, so my concern is like when we are sitting here, we are discussing the experience of the community. We are discussing all this systemic, barrier that communities women face, and all this systemic program, policy, and practices that create the intersectional inequality. We need to raise this concern to the policy maker table and political leader table or the decision making table to influence them. That policy should have to be changed based on the community's lived experience, because always this narrowness and shallowness of the recommendation and prescription create a kind of a situation that the problem is in here, the solution is not working. So if the problem is deep, solution should have to be deep. If the problem is deep and solution coming shallow, every time we see the exclusion for these women. So our request that we need to collectively work together to raise this concern in the policymaker table. All of you, those who are working as a vaccine ambassador, all of your lived experience need to come together to make some kind of prescription to the service provider to change their service model. So please, you are going to raise your living experience to the stakeholder table and say, I am a vaccine ambassador. I go door to door and I find it out, these are the inequality. These are the costs that I cannot support this person for the vaccine. A lot of times I told them that every intersectional inequality should has to be listed as a glossary and should has to be showing to the policymakers so then they can take it in accountable way to make the solution. So our concern is in here that we need to work together, and definitely we need to work together to make the solution in here. Two things that women need right now. One is economic empowerment. Another one is like their sustainability, their livelihood should has to be matched with their economical capacity. So that is the things we always read, that minimum wage should has to be increased to meet the living expenses. We said that inclusive social housing, we need it because social house give the capacity to up and down the range based on our income. And the third thing is we need a livable condition, because the livable condition means all the consumer a product price should has to be down, and it should has to be affordable for the people, those who are living in a low wage sector. Our SAWRO's approach is always alleviate the platform when we are reaching the glass ceiling. Alleviate platform means like all these racialized people, those who are living in a below Canadian standards, should has to be the platform should has to be pushed, and we deserve to live in a Canadian standard life. Canadian standard life is like not we are asking for $1 million. It is like we need a job that will give me a decent pay, and the job that I'm going to work 8 hours, bring enough money in the home, and also my household cost, housing cost, and everything will going to cover by this thing. So this is Canadian standard life that we deserve in here. So our request is like underemployment based that is creating from working below living wage, underemployment that is creating from not working in our related skill should has to be take a concern by and consideration by the policymaker to make some change. Thank you. Am I keep crossing my 10 minutes?
No, you're right on time. But as I'm listening,
Okay.
I'm wondering how you apply the intersectional lens when you do vaccine engagement. How your strategy incorporates.
So
that.
our strategy is like every case that we find it out that we are unable to serve in our moderate policy, we take this case as a special way to communicate and find it out where is the solution. So we navigate the system. Sometimes we see the system do not recognize the vulnerability, and so then we raise this concern in the advocacy table. So we see that when we raise this concern in the advocacy table or the decision-making table, then we see that they are kind of getting influenced to find it out a unique way to make the solution. So every ambassador, my request, you find it out that you cannot help this person bring this information to us, because we are the spokesperson for the decision-making table. So we take these things in the decision-making table, like Scarborough Health Network or East Toronto Health Network, and we're going to present these things that my ambassador feeling this barrier and cannot serve this person. So where is the solution? Bring the solution. So system glitch should has to be solved by the living experience. And here is very important that all of your living experience to supporting these people is very, very important. It's need to be go to the table, and that will go to influence of the change.
I agree. Thank you so much for starting us off so strongly. Keshawar, can you please supplement that with a little more of the community experience, the client relations that you've built throughout this pandemic? Thank you.
Thank you, Warda, for your nice introduction in the beginning, and thank you everyone, especially Sultana. She allowed me to come in here and just in this platform. Is very important platform. We can share our thoughts and everything. So yes, as a community leader, actually Sultana already mentioned so many points, so many what we want, what actually need for the community. But I will mainly focus on the client. The how we will encourage community people to engage in vaccination, to how the hygienic and everything, and especially the lived experience, because last few months I am working with the community very closely regarding the the COVID impact, response and recovery, what they want actually, what the different areas actually government should focus on, so that we could tell the government, we could take our recommendation to the government table, how we will eliminate some systemic barriers. So these things we are trying to gather some information, some impacts. Actually, COVID impact is not only for me, not only for 1-2 person. Everyone has have impacted by the COVID, right? More or less everyone, especially more specifically low income, marginalized and racialized women immigrant, and especially the community, our community especially, they are very much impacted by the COVID-19. If because I got so many lived experience last few months while we were working on a project. So so if I start from my experience as a mother, as a woman, as a working women, I could say that then we could relate that what kind of community impacts the community women are suffering right now. If I just go back to my life lived experience, that I was a student before the pandemic, and my diploma supposed to finish on April 2020, but in the meantime a pandemic started, and just very new, we started Zoom classes, right, which was very new for us. And after finishing, I had a plan that after finishing my diploma, I will start my work and everything, but due to COVID, all plan has changed, right? And so daycare closed. My kids, I have 2 young kids, so very young they are, so their school closed, daycare closed, and my husband is doing work from home. So in a small apartment, it's a very hard to do all these things, because it's a new experience for us. So suddenly I got I'm very fortunate that I got an offer from Sultana to work with the project with the McMaster University. So I will have to do the remotely work. So I was so happy that yes, I got a remote work, so I'll be happy, because due to pandemic I don't need to go to outside. But when I started my work at home, then the main challenges start, because it's very hard to working with the kids together. They are online school, husband's work and my work, household work. So it was so I was so devastated on that time, that how we will manage actually these things. And the most of the project meetings I was doing from the washroom, because the small apartment, it was not possible to everyone is working, everyone microphone is on, so I can't, I as a mother, I had to sacrifice. As a mother, I had to choose the decision, no, I will have to give them space rather than mine, because I can handle. So as a mother, I am focusing on these things, because as a mother, all mothers have to sacrifice themselves, right? In they are facing more challenges rather than other. They want to keep okay to the family members rather than herself. So this is my experience during COVID, and still we are in pandemic. We are not behind the pandemic, so we are still suffering different categories. So this is not only my situation. Community people, when I asked community people the impact of COVID-19, more or less more, some people are suffering more because of the accommodation, because of the job losses, income losses, and gender-based violence. Already Sultana mentioned how gender-based violence increased in the COVID, and the mental stress, especially mental stress, especially the kids' mental stress, everything escalate on this time. And when we asked people, like I got some information from one lady. She was doing hard classes in the apartment stairs. She lived in the high-rise building, so she couldn't manage, because she has three or four kids at home. They are doing school, 1-bedroom apartment. She was doing her study and classes in the stairs. Though during COVID, it was so unhygienic, and so the infection possibilities was so high risk. She did it, and she was just crying with me that I did these things, and I completed my study on like this. So, and the job losses, if I focus on the job losses, income losses, so many people, so especially women, they couldn't apply for the COVID benefit due to so many reasons. Like most of the eligibility criteria, government imposed $5,000. In some women, they couldn't do, because they all are minimum wage worker, and they are doing the manufacturing job, they are doing the retail job, and they are low income workers. So they couldn't, and the precarious, most of all the precarious, because precarious work, they didn't have any specific working hours before the pandemic, as a pre-existing situation. So that time what happened, they couldn't meet the $5,000 criteria. And another lived experience, I should mention that one woman, she was working part-time before the pandemic, and she went to COVID-related EI, but due to, I mean, her husband is getting ODSP. So after 2-3 months getting the EI, I mean COVID-related EI, so CRA called them, and CRA said, no, you are not getting this because your husband is getting ODSP. So finally, what happened? Still, last 2 years, it stopped. I mean, her EI has stopped, and still now they are, repaying the money what she got. So you see, she was doing the part-time job before pandemic, but due to her household income, and she was getting that EI, COVID EI, based on her income, her part-time income, but she failed to receive that the first. So this is the systemic barrier, right? So ODSP is different, and COVID, if it is emergency, why the government impose some bar, some impose the eligibility. Yeah. So still she is returning that money every month. So this is very, these stories are very common in the community. We found so many touchy stories. Another lady, her husband is not in here. She has still, her kids are not going to school. She chose the online schooling because her point is, my husband is not in here. So if one of my kids gets sick, how could I manage this thing? Because I have another kid, both are young kids. So for this reason, though they are vaccinated, full vaccinated, kids are vaccinated, but they couldn't go to the school due to the the panicking situation. It's not that it's a mental stress. If one of kids gets sick, then how she will manage? And she's not doing work because both kids are at home, and she's not getting the childcare. So these are the situation from the community. So I'm not taking too much time. I'm just coming another point, that returning work. So when we see the community people returning work after the COVID, so we see that most of the women, they couldn't return to work. Why? Because the childcare is the facility is very low. The school closure, because it's like back and forth. Sometimes school is open, sometimes again COVID. So employer won't understand the situation, right? So this type of things, so the returning is very slow, and the household work, and especially the in one research we found that Kathleen Scott, she wrote on in a report that mothers, it's a very short time gap from the work, maybe it's a 1 year 2 year gap, but the mother has a very long term effect on working, because they had a gap. They had a gap on the working, so the return to work will be very slow. She just assumed, and she just she made a report on that. So, and most of the work, most of the employer, they the automation services, cash and everywhere. So women are not that much skilled on that area, right? And so that's you see the most of the workplace, they need the automation services. So we will focus to, if you want to return to work, if government wants to, women should return to work first, then we need to focus on some skilled training, specifically training support resources for the women. And other thing I just want to mention, we found that fathers are easily, they return to work, but my mothers couldn't, due to some responsibilities. And if I mention the childcare facilities, because of the the mother are not working, and the hours for the precarious working hours, they are not getting the full-time hours. So, and to get the childcare facility, father and mother, everyone individually, they need to work weekly 25 or 30 hours, right? So in this precarious work nature, no women can achieve this 25 or 30 hours, so they are failed to get the childcare. So last election, federal election, government said that they will introduce universal childcare. Still, we are not getting universal childcare. All provinces except Ontario already launched the universal childcare. So we don't know when Ontario will get this universal childcare. This is the re-entry and absence of critical community support. So community support, this thing is important because we mentioned about the gender-based violence. It's not actually the domestic violence if we mention specifically. The husbands are not that much cooperated, I mean, according to the community people. So they need to focus all the household works, childcare and everything at home, and especially online school, what during COVID, mothers who are housewives, who are never worked before, they had to concentrate on their kids' online school, right? But they didn't get any incentive from the government because they didn't work before, right? And they don't have any 5,000 category and nothing they have, but they had to focus on their children education. So homeschooling they did. But teachers were getting the payment, right? Mothers are doing the homeschooling, but teachers are getting the. So those kind of mothers who never worked before, they suffered more, and their mental stress is more because they are at home. Before they were at home, during the COVID they were at home. So it's very the high mental stress they have. So we recommend that if it is COVID benefit, it should be for all, not for only the working people. Right, yeah, so this is emergency. So we should think about in this issue. And other thing is mental stress, already we mentioned, like socialization, kids socialization, mother socialization, this stuck on this community during COVID. And another thing is some like recovery, economic exclusion. So then also mentioned that women are exclusion from the economy. So we need the inclusive, inclusive policy so that every person, one shoe doesn't go with every person, right? Every person needs different sizes shoes so that they could walk on the bumpy, hilly area smoothly. Right, so we need those kind of inclusive policy. So like for single mother, we made some single mothers, they have different issues. They one person income, they have different so I mean social, because this community is very small, so community has so many issues in the community support is low. So and shelter home is we also mentioned about the facility of shelter home. Those are not supporting the women. So these so many things are together I mean impacted women very much during COVID. It's a like pre-existing situation, but during COVID we faced it more. During COVID we feel that we need it now. So we will try to focus on this thing, and we will try to take these recommendations, take these thoughts, because it's not SAWRO's only SAWRO's views. It's a community views. We are collecting these views, and we want to just put it in the government table very soon. So I think with the help of all organizations, with the help of all community organizations, we could do that, and we will be successful on that. Am I okay?
Yes, absolutely. I think that was great. You went into depth about, it's not just the simple statement of stay at home, right? It's so much more complicated than that. The tension between the spouses, the tension between the mother and the child, it's all exacerbated when we're all kept in isolation like that, right? I think you did a great job of detailing that. I do have an overarching question. Maybe Sultana, sure, you can address it as well. For those from the wider Toronto community, we have many people who've joined us today. What does a local citywide support look like for South Asian women or this community? It's a very specific community that you work with. How can someone who has no previous understanding of these issues offer support? What is the best way? I know you talked about policy reform and stepping up your role as an ambassador and making leaders accountable and institutions accountable for the promises they make to our communities. What are some steps that we can take here for the future and for 2020?
The things is in here, those who are working in here, they are representative each of the community. They are expertise about the community's concern. They have already trust in the community. These are the ambassadors who work in individual community. They have the trust on themselves. But when very beginning we see the vaccine engagement funding and the vaccine engagement initiative rolling, we see the city is starting with a very top-down way. They are bringing a certain group of people to be the leader of this vaccine engagement, where we find it out that our voice, our leadership is not recognized. So we have to push a lot. We have to push a lot in this stakeholder table, that these are the issue we have facing. And I just want to give one lived experience at the December, middle of the December, when we see the Omicron virus, heated in the community, and we see the number is so high. In that time, we see that where is this existing, testing center? Because Oak Ridge, we had lots of work with the city and influencing by the political leader to open a testing center in Oak Ridge. And that was established in June, July. So I thought it should continue. But when we December, we check it, that where is this testing center? We see it's disappeared. Without telling us, without asking us that take it out this vaccine, the testing center. And we get so disappointed. One only testing center was the Danforth, the Shoppers World. And the same place they are giving the vaccine. Last meeting, Wednesday, on Sunday, I told them that what kind of full process, like the, unrealistic and mixed map, initiative, that same line, people are taking the vaccine, same line, people are going for the vaccine, testing. That is a way we may mix the people for the more contamination. We see the Danforth line is how big this line is. It's passing through the metro to go. Lots of day, every single day, people are waiting in a cold weather, and people call us several times. Can I get a rapid test, please? And we could not get a rapid test any place. It's total out of the market. Not a city single official responded to me. Not anyone responded. Thank God, CASA give us 100 pieces of rapid test recently, but not a single place we get any help. We are helpless. If our hand is not strong, how we can make the community more strong? That need to be understood, that community organization is the key resource of the community, because they are holding the community. They have the trust with the community. If our hand is not strong, we cannot help the community, and they don't care about our hand. They just care about that how they can rule in on the top. So that city's initiative is not good. I talked with cities several times that vaccine engagement has to be bottom up, not top down. The total system, like how they will understand what is the cultural glitch we face in the South Asian community for the vaccination. I told several times that open a small childcare place very close to the vaccine, engagement process, because the parents need, with the children, they should go and drop the children over there to go for vaccination. Not a single place we see these things. We said that each of the school, each of the building, you put the vaccine clinic at November, September, we said this thing. And now they are in January, they start this thing. So system is so slow. We, the South Asian people, coming from a country where we face the disaster every single time, we have the capacity and knowledge how to manage in the disaster. That Canadian system doesn't have. When we start the disaster management very early, they started very late. So that is the mismanagement. The Canadian government should have to find out the expertise from our community who can do better disaster management. We have lots of resources in our community. All these international trained professional physicians ready to help in the community, but the system do not recognize them. So we need hand, we have hand, but we cannot use this hand. So these are the glitch we see in the decision-making process by the Toronto Public Health, by others that don't understand that how they will going to be solve the problem inside in the community. And they don't recognize the community organizations' skill and capacity to do this thing. If they're not empowering us, the problem will never going to be solved.
I think, the shift for 2022 is about empowering local voices. I think there's a concentrated effort now, thanks to you guys doing this work, thanks to sessions like this, we make the wider public aware that, you need to not only let us know what we need to do, but, uplift our voices and trust that we know our communities the best, right? This will be our focus moving forward. This is, this has been a great start. I want to hand it off to Nimra now, who will introduce our second speaker.
I'd like to thank SAWRO for sharing their work with us and giving us some more information about this topic. Our next speaker is Ansjot Kapoor from Punjabi Communities Health Services. Ansjot is a registered nurse with the Bachelor's of Science in Nursing from Ryerson University. She has been associated with Punjabi Communities Health Services in various roles over the past 11 years. Currently, Ansjot is the nursing manager at Region of Peel's COVID-19 Isolation and Recovery Center and manager of health at PCHS. Ansjot's education and experience in the healthcare setting have enhanced understanding of the resources to help vulnerable populations and how to respond to their complex needs. Ansjot is passionate to work and enhance her skills in the field of public health. Welcome, Ansjot.
Thank you so much for that lovely introduction. I'll go ahead and share my screen. Okay. Before we get started, I would like to thank everyone here for this opportunity, as this is very important. Talking to all of you, the community members, as well as our fellow community members as well, about some of the struggles our South Asian families has been going throughout the pandemic. Before I do get started, I know we already had a land acknowledgement. This is PCH's land acknowledgement, and I would like to acknowledge the Indigenous knowledge of wheel as well. So the topic that we will be touching upon today is the COVID-19 pandemic and its effect on South Asian families. Some of the discussion topics that I will discuss will overlap with our previous speakers. And please do let me know if you have any questions towards the end of the presentation. Some of the questions that we will tackle include, do women have a harder time than men during the pandemic? And is there any truth to that statement? How has this pandemic affected how mothers and children interact, as well as does this have long-lasting effects? So first, we'll talk about women and the COVID-19 pandemic. As we know, across the world, the COVID-19 pandemic has impacted millions of lives around the world. And what essentially the pandemic has done is that it's uncovered some of the biases and imbalances that our society and our culture already has. And these biases and imbalances come forward when there is a crisis situation, just like the pandemic. And these repeated lockdowns have impacted South Asian families, specifically women, because of the type of structure and the society that we live in, where South Asian women are the primary caregivers. And due to that reason, women have taken on more roles and duties. And I know our previous speakers shared some lived experiences as well, which really do show how women have, South Asian women have come forward and taken on additional roles and responsibilities, all of which are demanding and stress-inducing in family structures. I was looking through some research articles. This is from the United States, but I do find some truth in the situation as it might relate to the Canadian population as well. It states that women accounted for 55% of the 20.5 million workers who became unemployed in April of 2020, which was the beginning of the pandemic. And that's compared to a 13% unemployment rate for men. So the statistic here really opens our eyes and shows us that women were able to, or either they were let go of the jobs that they already have because of the pandemic, or they were required to resign because of the family structures and the dynamics, as they are the primary caregivers for their households. So this slide just ties into some of the statistics that we looked at. They are the primary caregivers in South Asian households. As we know, South Asian households, majority of the times, they do have multi-generation living with them, which includes their children. This could be their in-laws, which puts a lot of stress on the woman to take care of everybody in the house. Now, when we look at women in a different perspective, if they are not homemakers or they did not leave their profession to take care of their family, juggling that lifestyle is still difficult for women, because the majority of the frontline health workers are women. And this made women more prone to contracting the virus and also suffer its health consequences. So there's two sides to look at how this pandemic has impacted South Asian women. This picture here really summarizes sort of the juggling of different aspects of a woman's life in the pandemic. And as you can see, this includes, being there for the family and fulfilling the family's needs, being able to work, keeping your career in line, having that social aspect, as well as taking care of yourself and the stress that the pandemic has brought on. Now let's touch upon mothers and children interaction during the pandemic. Again, I was doing some research, and this the statements that I'm about to share are from a qualitative study where they were able to interview individuals, men and women of different age groups who have children anywhere from 0 to 18 years of age. So it was found in the study that parents were spending more time with their children during the first phase of the pandemic, and that was a qualitative kind of result of this study. And women more than men reported having to figure out how to balance their professional, family, and new roles during the pandemic. Now to sort of finish off and talk about some of the pandemic and its long-lasting effects. This might or might not impact us on a daily basis. However, because we are 2 years into the pandemic, the long-lasting effects are starting to show. And you and I, living our lives might be able to encounter these on a daily basis. So the first one I'll touch upon at the bottom right-hand corner is about healthcare. There are challenges in diagnosis, quarantine, and treatment of suspected or confirmed cases. So because of the overwhelming high burden of the functioning of the existing medical system due to the pandemic, patients with other disease and health problems are being neglected, or their surgeries or their important treatments are being postponed. There is an overload on healthcare workers, including doctors, nurses, and other professionals who are set at very high risk. And there is an overloading of medical equipment that is required, and there's a requirement for high protection as well. So definitely the impact on the healthcare system because of the pandemic is coming forward as it is burdened by the the COVID-19 pandemic over the past 2 years. The second one we'll touch upon is global economy or economic sort of long-lasting effect in general. This is, essentially we see it now over the past couple of weeks. We've been seeing a certain inflation of our necessities, so which really does show the slowing of the manufacturing of essential goods. So pandemic has impacted that. There's a disruption of supply chain of products, poor cash flow in the market, as well as significant slowing down in the revenue growth. Another big one is the social aspects. Now, this is a very broad term. Either we could look at it in terms of, how we are being impacted socially because of this pandemic, because of the social distancing and the several lockdowns that we have gone through. But the service sector is not being able to provide their proper services. So that's another way to look at it as well. There's cancellation and postponing of large scale of sports tournaments. So that is also part of your social disruption as well. And this just, because of this social isolation, there is lots of stress in the community. And we see that on a daily basis as well, being at the Isolation and Recovery Center for COVID, lots of individuals that come in, as well as women who come, usually we do see South Asian women that come in with their children that are isolating. Either they're single mothers that are living with their parents at home, but they also have young children. So to appropriately isolate at a different facility because they don't have enough proper isolation at home, when we do speak to them or do our assessment, not just medical assessment, but also social assessment, we do see a lot of stresses that they're going through. Either it's financial because now they're home because of their kids, taking care of their elderly parents. And now they are socially isolated for X amount of days where they're not able to go to work and they're bound to isolate in such situations. Other sort of long-lasting effects on the slide here include the future of work. How does work in a different environment, such as the office environments, how does that look like moving forward, as well as the education of our kids? I know our speakers touched upon that as well. So see, these are some of the long-lasting effects. Of course, they can vary person to person, and we'll know more as we move on, or we are part of the new normal with this pandemic as well. Now, I would like to talk about some of the resources that PCHS provides for individuals. So we do use a culturally competent approach with all of our clients. So if anyone here or any of the community members or the other organizations would like to refer their clients for either COVID-19 support or any mental health stresses, you can contact us at 905-677-0889. Or if you're looking for specifically COVID-19 support line, this support line does not only offer the Isolation Recovery Center referrals, it is also able to help you financially, even if it is for groceries while you are isolating or you're not able to go to work, so you need to apply for other benefits. This is our support line. We do speak South Asian languages, so you are able to appropriately communicate with us. So that's 416-605-6134. And this line operates 9 to 5, Monday to Friday. There's more information available on our website as well. We offer a variety of different programs, and that's pchs4u.com. Or if an individual does not want to contact us through phone, they can also email us at info@pchs4u.com. So I just wanted to go ahead and share some of these resources as they are available to our South Asian community and other community as well. That concludes my presentation. I'll be happy to take some questions now.
Thank you, Anshut. That was great. That presentation was amazing. Thank you for sharing all the resources. One common question we have here is, what are some ways to support women in their daily lives or in the household, and how can we repair the stress the pandemic has caused to the South Asian family structure?
Okay. Thank you for that question. I think that's a very important topic, and it's a broad topic as well. If we do look upon some of the structures of the South Asian families where women are being impacted by the COVID-19 pandemic, and we do have to realize that this already existed, but because of the pandemic, we have now seen more effects of it come through. And the way that we support them is by using a culturally competent approach where an individual with either a lived experience from that community is able to support you, is able to listen to you. Sometimes the supportive counseling does help quite a bit, able to connect you with resources that are focused on your needs. I think that's essentially what can be done in these situations. And again, there's lots of advocacy for situations like these. We are constantly advocating on our clients' behalf. If we don't have the funding for say, or if we are not able to connect them to the right resources and are not able to provide the resources to them, there is lots of advocating on our part for our clients in that manner as well.
Thank you. As a follow-up, I'd like to maybe ask that many audience members or viewers here are part of a South Asian family, right? I myself am part of a South Asian family, and I've seen how the pandemic has shifted our dynamics, right? I think on a more personal approach, how can I be a better family member, if that makes sense, and take into regard, like, what are some steps, what are some daily practice, self-care, if it refers to it, that can help sort of mitigate some of these, tensions in the household?
Right. That is a very important concept that you've touched upon, because the way that I look at it as well, and this is what I tell some of my patients that are self-isolating or are stressed because of the daily sort of the structures in their South Asian families, I do tell them that you have to take care of yourself before you take care of others. Because if you're not well, how will you support your family? And the way that if there are challenges in the family, it is important to meet with the entire family and kind of determine some of the tasks and divide them, which also takes stress out of you per se. And you are not the only individual that is supporting the whole family. So the whole family is, takes responsibility for certain duties, and that's how sort of you can alleviate some of the stress as well.
Sultana, do you have anything to add to that?
Yeah, I just want to add something with Ms. Kapoor. You just explained very well that we, as a service provider, as a community-based organization, we listen first to them and connect with them, a lived experienced person to give some, but at the same time, we do advocacy work. The whole society needs a safety net. And we see that South Asian communities, the safety net is not working. Like all this government safety net systemic support is not working for us. So until we are not building a system properly, what we do it, like we are supporting, listening to the communities people, and we work together to solve the thing. And as a, a young women perspective, as a young girls, that is the things you said, that family should have to be bonded together. One way people are, criticizing South Asian community that we are intergenerational bonding and we live in a multi-generational house. But this is one aspect is economic issue, that our young generation is still not ready to go outside to creating that, individual family because of the financial. Another way is like we have a strong bonding, love, that we like each other. Our children's taking care a lot during the pandemic to the parents, and parents also working together. Because of this bonding, we are supporting with each other. I see lots of children are helping their parents totally for their social communication need, virtual communication. We are very thankful and grateful to our young women, young girls, and they are supporting a lot. This bond is an asset for us. So like, rather than people criticize us, we should say that this is the bond, how we can use this bond to support us together to come out from the pandemic. And sometimes the bond, we need more safety net, so then we can feel that we can support the people. Yeah, thank you, Kapoor.
No, that was beautifully put. Our families are a source of strength. And by no means is living in an intergenerational household, a negative. It can be a great source of support, especially during times of, isolation such as we are now, right? So
one thing, just one thing. Sorry, I'm taking a lot of one thing is that intergenerational conflict that we have, that we are coming from a patriarchal society, and we have a kind of model that we give our male partner more. That things is changing right now because of our young generation. It is a renegotiation process, and this renegotiation happens in every culture. So it is normal. It's not like we have a cultural driven issue. No, and this negotiation will going to be faster if we have safety net. Like if all of the young children, young girls get a job, better job, they can stand up for their right. So that is the things we need to talk together, that defend it. That intergenerational conflict could be minimized, and it's like renegotiation is done. We need a strong safety net. Yes, sorry.
No. I was just going to add that I see that as well. I see this pandemic as a way to bring about new conversations, right? Even within your family, saying that, hey, I think that there needs to be, us dividing the duties. we both need to be responsible for this household we're living in kind of approach, right? And it doesn't have to do with culture, because that's a very narrow understanding. It happens across, cultures. It's something that is about empowerment, as you said, Sultana, and it touches on various different factors. That brings us to 4 o'clock. I'd like to thank all of our speakers today, and a big thank you to everyone who attended. This first session of Pandemic Reflections has given me a lot to think about. It's given me a lot to bring back to CASA and SAVEC and find new ways to engage. Send in any remaining comments you have for our speakers to myself or to Nimra. You can also send in questions and concerns, and of course, feel free to use support services shared today. Please also look out for our next webinar later this month that looks at vaccine engagement in racialized communities across Toronto. SAVEC is committed to providing a space to continue these important and necessary discussions. Thank you.